No one wants to lose control of their bladder and accidentally urinate. However, doctors say this is a common problem for women. It is called stress incontinence. It can affect you when you are just laughing, sneezing, coughing, running, or heavy lifting. And this Ask the Experts, Dr. John Baten of Urogynecology Associates says there is no reason to feel any shame, and he explains what you can do to stop it.
A whole lot of forms of incontinence, but two majors. There's stress and overactive bladder. And they're different in that stress incontinence is an anatomical or structural problem. So either through childbirth, aging, or a combination of aging and childbirth, the ligaments or the muscles around the support of the urethra and the bladder get weak. And so the pressure transmission from the bladder to the urethra kind of loses it. So when you cough, the pressure in your bladder automatically is transferred to your urethra. So the urine comes right on out. So that's a structural problem that's fixed, can be fixed by pelvic floor exercises in mild cases where people tighten up their pelvic floor muscles and learn little tricks like, when I go to cough, let me tighten my pelvic floor muscle. Other people require a little bit more involved therapy for it. And there's two different types, because stress incontinence can either come from the urethra and the bladder being overly mobile, or the neck of the bladder where the urethra joins it becomes kind of open and kind of stiff. So those people, you need to inject a little gel or polymer around the bladder neck to kind of squeeze it down. The other people that have the urethra that's really mobile, they do better with like a little sling. And they're all minimally invasive now, simple outpatient procedures, usually take about 15 minutes to do. You're back on your feet pretty quick. And some people actually have a combination of that. And most people think that people with stress incontinence lie on a continuum between one or the other on there. So a lot of times, figuring out what's right for the patient is doing the exam, seeing what their symptoms are, taking their age into consideration, and then finding the appropriate treatment from there.
This Ask the Expert segment on Today at 11 is sponsored by Urogynecology Associates in Flowood.